We've explained a few times that the halacha's description of a chole differs a little bit from the modern science understanding of what a chole is. And it comes out a few times when we discuss different chole shebetoch halal haguf. If it's the Gemara and the Halakha's interpretation of a choleh is if it's in the inside of the body, they viewed it more severe versus an outside. Versus like we explained, Sakanat Ever, where the Shulchan Aruch seemingly wasn't so concerned, but today the Halakha, we are machmir also with Sakanat Ever as well. But just to explain a little more of these inside any internal elements that we break Shabbat for. The Halakha explains, Kol choli shebetoch halal haguf ben bepiv ben b'sfatav hasfatayim v'lifnim, from the mouth and inward, any illness is from the mouth and inward and inside of our body. Ben b'me'av o bekaved o tevchol, whether it's in your stomach or intestines, wherever it may be. Harezeh chole sheyesh bo sakana u'mechalin lav et Shabbat. It's considered a chole sheyesh bo sakana, and you break Shabbat for that sake. Ulam im yodim u'makrim oto beoto hacholi shemamtin ve'en tzarich chilul asur lechalel lav et Shabbat. However, if we know that this specific ailment doesn't need me to break Shabbat, I know it's a regular stomach virus, and we've seen it a million times, and in 12 hours it's going to become better. In that scenario, you don't have to break Shabbat things to the hospital. But generally, the halakha explains any internal wound, anything that's inside the body, we view very seriously, and we can break Shabbat for. However, someone has a severe abdominal pain, stomach pain that they don't know why it came from. It came randomly. It's not a stomach virus pain. They're not throwing up from it, or even if they were, but they can't tell you why it's such a severe pain. And they try to soothe the pain by taking different drinks or medications and the like. Halakha explains, Mechalin alav et Shabbat. You can break Shabbat and go to the hospital to make sure there's no severe problem with any abdominal pain. Can be severe issues as well. Additionally, any stomach pain against children, by babies, by infants, we don't try to brush it on the rug. And if there's a concern, you don't just wait it out. You go to the hospital and get it checked out. The Ovadia even had someone who's suffering from diarrhea. He can take medication to prevent that. He doesn't have to just sit there suffering on Shabbat. These things allow him to take medication, and if we're concerned that he's dehydrated from it, he explains as well, you can go take them to a hospital as well. And he continues and says, what about different types of cuts and different types of bruises and abrasions that are on the outside? So we've explained internal wounds and ailments. What about external, on the surface of your skin or on the outside of your body? And he explains, any injury, any wound, any cut, or gash that was done by a barzel, by metal, even if it was just outside and didn't really penetrate much, but it caused us some sort of gash or cut, we break Shabbat for it. Why? We're very concerned with metal. It can cause different types of infections, different types of issues, that when there's cuts that happen with metal, science agrees with it as well. You should go right away to the doctor and get any shots that you need to prevent any dangerous illnesses. Chas v'shalom. לפיכך, מי שיש לו חתך באצבע מחמת סכין וכדומה, מותר לו למרוח משחה על התחפושת ולחפוש את אצבעו, וכל שכן שמותר לעשות כן על ידי גוי. Someone gets a cut on his finger. Doesn't need stitches, but it's a relatively deep wound. He doesn't want it to get infected. He's allowed to put on Neosporin and a Band-Aid and cover his wound like that to prevent it from getting any infection and the like. And similarly, any ailment, any illness that the doctors say that is extremely dangerous, even external, doesn't need to be internal, you can break Shabbat for and get proper help. Chazak ubaruch.